Hey everyone, it is Kevin Henry, the editor-in-chief for Bicuspid.com. I am thrilled to be on with Dr. Dan Butterman today from CDOCS. Dr. Butterman, how are you?
I'm doing great. Thanks so much for having me on today.
Hey, excited to have you on, and I'm excited to kick off this series that we're going to be doing with CDOCS, and we're going to talk about that in just a moment. But obviously, I'd love for our audience to know a little bit about you before we dive in.
Oh, appreciate that. So I'm a practicing dentist in Denver, Colorado. This is my 30th year of practice, actually. Kind of excited about that. Time flies. When I'm not doing clinical dentistry, I spend a lot of time teaching for CDOCS. I rotate through all of our CEREC workshops, everything CAD-CAM related, also a lot on the implant side as well. And then as of January, I'm a faculty chair for CDOCS, which means that the entire curriculum is now my responsibility. Uh, all of the workshops outside of just CEREC, meaning our implant workshops, our endo, our ortho, all of that. So I have a ton of fun on the teaching side. I have a ton of fun with the faculty that we have. I get to experience many, many doctors coming through our workshops. I think last year we had over 5,000 doctors that came through our workshops. So
Wow.
my life is full between clinical dentistry and doing all the teaching and the whole faculty side of CDOCS. It's been pretty wonderful.
Yeah, I can see by the smile on your face, it's a passion of yours, obviously.
It really is. It really
That's
is. It's hard to know which I love more because I still love being engaged clinically. I think that's so relevant and important to teaching. But those sort of light bulb moments when I see people come through our workshops and they finally figure out exactly how things can change their practice and do things better, faster, easier. Like those are the things that get me excited.
And let's back up for just a minute because I want to make sure people know what CDOCS is and maybe a little bit of history behind CDOCS as
Sure.
well.
Yeah, so CDOCS is a part of SPEAR, and SPEAR Education runs many workshops. We've been around for years and years on all areas of dentistry. The CDOCS side really focuses in on, well, it started off focusing in on just the technical pieces, meaning that you buy a CEREC, you have a CAD-CAM that you introduce into your office. Maybe it's just scanning, maybe it's scanning and milling. And then what are all the things that you can do around it? And so we sort of built things up to be maybe starting on a fundamental early level where I just am introduced or I've just started manufacturing restorations in my office. I'm now doing single visit dentistry. How do I prep the tooth properly? How do I use the software to get a good design proposal? What if I do if I can't get a good design proposal? What are all the blocks and materials? How do we bond these into place so the patients aren't sensitive and they stay in place? So we start on those sort of basic levels, and then we discovered that people really want to do a lot more.
Mm.
And so we move beyond those basic posterior crown and bridge and really maximizing efficiency with that into our anteriors. And then we move into implant restoration, full arch cases, and then basically some of the advanced in-lab features with more advanced softwares as well. So that's sort of been our game plan or our model is how do we take all of this information? How do we take the equipment that people are using that they want to become better and more efficient? And how do we build this in really not just teaching how to use it, but the actual implementation, the Monday morning use of it so that it can be practically put into place with your first patient after you come back. And we sort of evolved that. And we really just started on that side. But we discovered that there was so much more that people needed in their practices. And so we're very fortunate to have some of the best faculty globally. We've brought in a number of specialists that are teaching our implant placement workshops, all areas of surgical placement, from planning, single tooth, all on X, all of that. We also do a tremendous amount on beginning and advanced endodontic treatment, clear aligner treatment. So we try and cover the whole gamut of what are the areas of your practice that we can build you up, make you more efficient, make you better at. And that's really been our focus over all these years.
That's fantastic. And I know, looking at your bio of your practice that you have here in Colorado, you're a technology focused guy. And I know that is something that's very important to you. How important is continuing education when you have a tech focused practice?
Yeah, it's like I like to say, one of the things that I also do is beta test for multiple companies, and what I've discovered in doing that is that sometimes when you use technology or buy technology, you're not just on the cutting edge, you're very much on the bleeding edge of this technology. And it really can be one of those things that things change so quickly. And I'm shocked by how people implement technology and then a few years go by, and when they circle back and they take one of our workshops, they're shocked at how much things have changed, whether it's software, materials, just entire workflows. So uh, all areas of dentistry, I think the education, that piece of it, is so important to make sure that we're staying with times, because everything changes, all procedures change, but technology is sort of light speed. And what was status quo and what was state of the art a month ago might be irrelevant, and there might be something that's more relevant, that's faster, easier, better. So staying on top of it is critical. And it's hard to do that on your own. And so partnering with an education company that can get you there, I think, is helpful.
And I want to ask your thoughts on this next generation of dentists that are coming in. I mean, obviously they're very used to the tech, but they're also, I've heard some things about continuing education, and their thoughts on that may be different from previous generations. Are you seeing that with CDOCS, and or are you seeing the younger generation really getting that mentoring that they may need from the current members of CDOCS?
It's funny you ask, because that is as near and dear to my heart as can possibly be, because 2 days ago, my son graduated from dental school. So
Oh, congrats.
he is one of those brand new dentists coming in, and not surprisingly, he will go through the entire Spear curriculum and the entire CDOCS curriculum. He's already been through a fair amount of it, because schools, as wonderful as they are, they're so there's so much information that they need to get out, and just the level of focus. They need to understand how to make a crown, and they need one way to make a crown, not necessarily the way that people are currently doing it today, but they just need to have the basics down. And I think all of us would agree that after dental school, that's when the real learning starts. So being able to have mentors on the CDOC side that have been there, done that, have been in that position, I think is critical. And we've really seen that shift in our workshops, where certainly we have veterans that are there that just want to be more efficient and that just want to pick up new things. But brand new associates, brand new partners, people just kind of entering the field, that feel a little overwhelmed, and maybe they're stepping into a practice that has technology, and they feel a little uncertain because of what they learned in school or didn't learn. So that piece of it is important. I feel like it makes them a little bit more competitive as well in the market, because now they can step into an established practice, somebody that has all the whether it's CBCT or some sort of CAD-CAM system, and be able to step in and be able to be productive right away. And that mentoring side of it, I think, is critical for anybody, but certainly the newer generation. And I think they appreciate that, and we are seeing that huge influx into our workshops.
Well, that's awesome. And congratulations to you and your son on that milestone. That
Thank
is
you.
fantastic news. Absolutely. And I am thrilled that Dr. Bicuspid is going to be working with CDOCS. We're going to be producing on a regular basis the tip of the day, make sure that, the brain trust within CDOCS is sharing their knowledge. But one thing that I love about these tips of the day is that they're very short, sweet, and compact. I mean, you're getting a lot of knowledge in a very short amount of time. And I'm curious, what's the thing that you love most personally about these tips of the day?
Well, I think you sort of nailed it, and I think one of the things that, if you come to a workshop ever, or you take any continuing education ever, I think what we all hope that we take away those one or two pearls. What's that moment that made it worth it for you to get on a plane, to leave your practice, to show up, something that you can implement right away? Well, we know those points. Having taught thousands of dentists for years and years, we sort of see what are those pieces of information, those light bulb moments, those maybe pain points that are in practice, and we focus on that for our tips. And I got a bad crown proposal, and how do I get past it? I'm designing an anterior case, and my hygienist is pacing behind me because she needs me to do a hygiene check, and I'm starting to get stressed. What do I do? How do we move these things forward and get really nice proposals very quickly? Any of these tips, maybe it's I want to start restoring an implant, but I don't know what a scan body is or what the right scan body to use is. So those are the areas that we focus on, because and let's be real, it's not just the younger generation. I think we've all sort of been trained with social media to kind of digest things in these 1 or 2 minute bites. And we sort of get that information and need it very quickly, because our time is just pulled in so many different directions. So that's the goal, is we want to give you a valuable piece of information. Maybe we solve a problem. Maybe we just teach you something you weren't aware of. And that's something that you can just take with you. There's no fad in this. This is just these are the pearls that we're trying to put out in all areas, not just CAD-CAM dentistry. We'll be expanding into endodontic treatment and implant placement and planning and ortho as well. So all of those areas, we want to be able to take those individual pieces that we feel are the most valuable, and just put that out to everybody.
I love that. And again, we're so excited to be partnering with CDOCS on these tips that I think are going to be of such great value. And I'm excited that you're actually providing the first tip in this series. So I wondered, would you give our audience just a little bit of a preview of what you're going to be talking about, as well as I should say, maybe why you're so passionate about it?
Yeah, of course. Thank you. And just to be clear, Dr. Bicuspid has been one of the sites and one of the areas that I focused a lot. It's where I go to for information, to be perfectly honest with you. I am a huge fan. And so the fact that I get to partner with you guys, just so you know, it's a thrill for me. And I do really appreciate all the information you guys get out, and it really is incredibly well done. So
thank you.
You guys have set the bar, and I appreciate you involving us in this. But one of the areas that I do want to start with the tip is probably something that's overlooked very often in the software, and that's the virtual articulator piece of the software. And I think people that have designed crowns for many years are surprised sometimes, because we figure out what the occlusion should be on a crown by looking at the color. And we say, all right, if the crown proposal is this particular color, I would expect it to hit this heavily in the mouth. But unfortunately, the software only gives a static measurement. It just gives a distance from your crown to the antagonist tooth, but our patients aren't static, they're dynamic. And so there are features of the software that allow the software to show you all the potential interferences and dynamic interferences. Because, and like, I feel like it's such a great tip to understand how to use this, because many of us will put a crown in the patient's mouth, and the very first time we notice that there is something wrong or miss an excursive movement is when the patient calls us in pain. And that's not efficient. It's like a loss having an extra appointment, having the patient be uncomfortable, or maybe we do find it. And then you take this brand new crown, you put it in the patient's mouth, and you start grinding on it for the next 5 minutes until the patient says, does this actually fit in my mouth? And it's like that awkward moment.
Sure.
We can find that in the software. And so I want to make sure that people understand very quickly, in a minute or two, how to activate this. And that alone, I feel like, can save hours and hours over the years with putting crowns that need adjusting.
Well, I appreciate the kind words about Dr. Bicuspid, but absolutely, I think this is such a huge piece for us to be able, as you said, to quickly allay some of those fears, maybe some misconceptions that are out there, and help dentists and team members perform at a higher level. So could not be more excited about this. I'm anxious to see that first tip go live. We will make sure that we are linking this podcast to where that tip will be so that you all can see that. So look for that in the show notes. And Dr. Butterman, before we go, I want to make sure people know where to go to learn more about CDOCS.
Yes, our website is just CDOCS.com, and all of our education is on there, our in-person workshops, our virtual programs. I would encourage you to take a look at that and kind of figure out what we're all about, because we do have a tremendous amount of information in a lot of different areas, and we're constantly adding new workshops.
Well, it sounds great. I know, again, we're going to be kicking this off. I'm excited to see where this goes, and I'm excited to see all the learning that's going to happen. So, Dr. Butterman, thanks to you so much for your time today. Looking forward to working with you.
Thank you so much. I really appreciate it.
And thanks to all of you who listened to this episode of the drbicuspid.com podcast. We're always trying to bring new things that are going to help our readers be more successful at what they do and also love what they do more every day. So until next time, Kevin Henry, Editor-in-Chief, signing off, and wishing you nothing but success ahead.